The imaging forms part of the holistic care and management of the patient. So the clinician would have assessed the patient and decided they suspect these injuries. The imaging performed will allow a diagnosis of the imaging and a grading of the severity of the injury. And that's a critical component in deciding what the appropriate management is. I'll give you an example with a knee injury. One may have a complete tear of the ligament, and that unfortunately renders the knee unstable. And usually, or in most cases, that will require the ACL to be surgically repaired. Because if one doesn't do it and the knee is chronically unstable, that can predispose to accelerated damage within the joint. So it's the location of the injury and the grading. So if the ACL injury was not a complete tear but a sprain, that would heal on its own and wouldn't require surgery. Another knee injury is a medial collateral ligament, or MCL injury. In comparison with the ACL, these are usually treated conservatively. So even in a complete tear, often the clinician will decide not to surgically repair the ligament because it can scar down and become functional just with conservative management. So there, the imaging plays a critical role in revealing what structure is injured and how severe the injury is. And that allows the clinician to make a decision on what is the appropriate management. Is it surgery? Do I need to go in and fix the structure? Or can I be conservative, and then it's usually immobilization, ice, analgesia, and then progressive rehabilitation.
What do athletes need to know about radiology in post-care is that after having any sort of imaging and the patient did require surgery or any sort of intervention, radiology is then still required afterwards to determine the healing process.
The need for patients to come back for follow-up imaging is highly dependent on the nature and severity of the injury they've sustained. For example, if it's a fracture, that would typically need follow-up x-rays at a regular interval to ensure that the healing process is occurring as expected and that there are no complications. In a muscle injury, it may be that imaging is only required at a once-off setting, and if the injury is not too severe, a diagnosis is made, a treatment plan has been formed, and the patient or player can continue on that pathway, and no follow-up imaging is required. If the clinician suspects a complication or it's a complex injury, then follow-up scans may be required.